pharmacist, National Vaccine Ambassador and Pharmaceutical Society of Australia. Thank you very much, Anna, for stepping into this particular interesting spot. So thank you.
Thank you, Rod. Thank you for clarifying what PSA stands for. I've had a few prostate conversations over morning tea. So I am thrilled to be here because this topic sits right at the centre of my work. And so when I was asked to speak, I said yes faster than I could sprint. Because with adult vaccination, we are actually at a crossroad. And we can either see this as a challenge, but I personally like to view it as an opportunity. So before we start, a little bit about me. So I am a community pharmacy owner. Sorry, I feel like the microphone's going in and out. I am a community pharmacy owner. I'm a vaccinating pharmacist. I am the mum of two small little friends, or colleagues as I like to call them. But when I'm not doing that, which is my actual favourite job, I am the PSA National Vaccination Ambassador. And it is through this work that has truly become the heart of what I do, building systems that make vaccination easier for patients and sustainable for all of us as the providers. So let's begin with the challenge. When we think about under-vaccination in Australia, of course, we tend to think of the children. The moment childhood rates drop below 95%, it is front page news. We have policies like no jab, no play, and entire campaigns devoted around to the benchmark of 95%. And it makes the news cycle and it sounds a little bit like this.
Childhood vaccination rates have fallen to critical lows in Australia at a time when we are seeing the re-emergence of diseases like polio, diphtheria and yellow fever right around the world. Here in Australia, Queensland is also currently in the grips of a measles outbreak.
Meanwhile, quietly, one of our most under-vaccinated groups is the adults 65 and over. The population most at risk from seasonal age-related disease. This NSAID's report, which is their interim coverage data, and it clearly shows that the uptake of influenza, pneumococcal, shingles and COVID is well below the target. And if we zoom out, the impact sharpens. Our older population is 17%, makes up 17%, but they account for 70% of vaccine-preventable disease hospitalisation and 90% of related deaths. Each winter, we see the same predictable patterns and the surges and the same complications, the same admissions, and the same loss of independence. And these aren't unexpected events, but they are preventable ones. So why the risk? And thankfully, we had Paul this morning mention this. And as our immune system sort of naturally slows, I guess, the process of immunosenescence, the gradual decline in both the quantity and quality of our immune response. And it affects everything from T cells and B cells to macrophages, natural killer cells. As mentioned, it's driven by thymic involution, so I won't go too much into this. I'll save time for more conversation later on because we already covered what that is. And what I will quickly touch on is a graph that I like to use in my pharmacy, and not just with patients, but with my staff as well. So Ali talked this morning about how we can really involve our team, and these are really helpful tools that it sort of shows that theoretical shingles threshold, and then sort of the cellular immunity kind of going down and down as we age, and sort of people who are immunocompromised, that goes down even earlier. So yeah, don't want to spend too much time here because obviously we've already covered that this morning. But it is a helpful graph, and it shows that adults 65 and over, every season brings new threats, and vaccination remains our most practical tool to flattening those peaks and to protect this cohort. So when all the evidence points one way, why do vaccination rates in older adults remain so low? And I have done the research for you. I've looked through NSAID's, ATAGI, WHO data, and the same 4 barriers kept coming up. Access barriers, missed opportunities, misinformation, and complex schedules. And notice nowhere in these findings is the word refusal listed as a main reason. Because a barrier isn't resistance, it's the friction between the intention and the action. But of course, identifying these barriers is only the beginning. The real challenge is turning that insight into action, practical, workable steps that remove those barriers for good. And we've just had David stand up and tell us about this guy. And we didn't compare notes. I put this one in here as well. So it's a beautiful strategy that's about to come. It's got a vision. It's simple: a healthier Australia through immunisation, and its mission to reduce vaccine preventable disease through high equitable uptake from infancy to older age. As David said, it identifies 6 national priorities. And because I've only got 25 minutes, I'm going to focus my recommendations through the lens of the first 2: access and equity, and trust and communication. And because priority 1 is priority 1 for a reason, let's start there. And the 2 goals that stand out for older Australians: partner with communities to understand barriers and co-design solutions, use innovative delivery models to increase equitable access. Because for many older adults, the challenge for us isn't persuasion, it's practicality. The Older Australians report captured it perfectly. Mobility limitations, transport difficulties, and costs are the key barriers preventing many older Australians from accessing preventative care. In other words, the problem isn't apathy, it's logistics. It's friction between intention and action. It's how do I get there? Who's going to drive me? How can I afford it? And every one of these small hurdles adds up. But don't just take my word for it. Let's look at the evidence. There's a 2024 meta-analysis by Liu and colleagues, and it was published in the Nature Human Behaviour. It reviewed 88 randomized controlled trials. It involved 1.6 million participants across 17 countries. So this information had some pretty clear findings. The first one was this: interventions that reduce barriers and make vaccination convenient delivered the greatest improvements in uptake. Participants in access type interventions were around 1.5 times more likely to be vaccinated than those receiving standard care. The biggest gains came from walk-in models. So it was a odds ratio of 1.42, so that's increasing by 42%, I guess is a good way to talk about that. And then by taking the vaccines to the people, so people like the aged cares, the borders, the communities, it had an odds ratio of 1.68%. The evidence was consistent. When vaccination is offered in person on the spot, people got vaccinated. And if you think this is just overseas data, think again. Here in Australia, the challenge isn't that sorry, now I'm laughing at my own meme. Here in Australia, the challenge isn't that older adults aren't seeing us. It's that when they do, we're not taking the opportunity. And this is a really alarming NCIS interim report. Most under-vaccinated older adults had healthcare contact in the last 12 months, but weren't offered a vaccination. That's not refusal, that's on us. And so this is our first practical pivot to start increasing vaccination rates. Immediate vaccination must become the standard of healthcare. And now I hear you say, oh, Anna, how on earth do you expect us to do that? And I hear you. My own experience suggests otherwise. When I first bought my pharmacy, it was a 1 pharmacist, 1 clinic room. We had 2 extra staff members and we implemented this model. And we've grown now that we've actually got multiple pharmacists carrying out vaccination. So it is doable, but let me quickly show you how we did it. Step 1, as Ali emphasised, we utilised our entire team. We trained every team member to recognise a vaccination opportunity and to act immediately. If someone came in and asked any sort of question about a vaccine, no brochure was handed to them, no booking was made. We literally just walked them straight down to the clinic room. we had a dedication vaccination space. And if someone was in that clinic room, we have 2 chairs waiting outside, so they're just put in order. Step 2, pre-screen and prepare. So we use an amazing software for our vaccination program. So pharmacy do have a traditional one. I'm going to be mindful not to mention software providers. I'm sure there's, yeah, I won't. But I like the one that we use because when we book the patients in, it actually emphasizes what that person's eligible. So if they put in that they're over 65 because, you know, we get their date of birth, or if they identify as Aboriginal or Torres Strait Island, or any of the information, the vaccinations that they are eligible for come up as an opportunity to be booked in for. So my team member can sit there and say, oh, look, this is what you've come up for. Oh, can I get them all? Oh, look, I don't know. You're going to be talking to the pharmacist about it, but hey, why don't we book you in while you're here? So any staff member still, action, they're going to complete the data entry. So all of the booking in, and then naturally the pre-screening will get text to the patient and they'll encourage the patient to do that. So what's the goal here? Before you've even had to walk into it, you've got a fully screened and admin completed patient. Step 3, well, at some point we are going to have to be involved if we're the vaccinator. So we get to step 3. Who? So vaccinating GP, could be the nurse vaccinator, but obviously in our scenario, it's the vaccinating pharmacist. So when I'm walking in, it's a very natural conversation. Good morning, Mr. Smith. My name's Anna. I'm the vaccinating pharmacist today. Thank you so much for filling out your information. Let's go through it together. While I'm looking at it, do you have any questions? How are you feeling today? Oh, I can see you're due for all of these vaccines, you know, and it's a very natural question because I'm not focusing on the data entry anymore. I'm focusing on the air. I've drawn their air data and I'm looking through that and I'm having those conversations. Is it safe to do? Absolutely. In fact, we've got safety data that shows that there's not a greater increase in adverse effects. So it becomes a natural conversation, but it's also like, what an awesome workflow. You're not having to start at the start just to ask someone what their name is. So I've gone rogue off my notes, which often happens when I get passionate up here. So let's see where we're up to. What I would like to say is that this simple change in workflow increased our vaccination rates in our pharmacy, and we had an uptake of 900% in the first 12 months. It works. But as we said, accessibility doesn't stop at your physical surgery or my pharmacy. For many older Australians, particularly in residential aged care, coming to us isn't even an option. We have to go to them. In fact, there are currently 258,000 allocated aged care places in Australia. That's 250,000 of our most vulnerable individuals that have a massive access barrier. And it's our job to change this. In fact, that's what I've spent the last few years doing. So what I worked out through my through my experience, I guess, and I guess going before a lot of others, that this access gap was not just the physical component. It was the fact that there were multiple providers involved, a huge administrative burden when it came to getting consent, limited staff capacity, especially at the homes, incomplete records, and quite frankly, it was just an unsustainable system. This was not a vaccine problem, it was a process problem. And so what did I do? I endeavoured to fix it. So there I am, going in, just proof, I guess, doing both. And I started to become what we would call the immunisation coordinator of each facility, not just for my customers or for my residents. I started creating an overview of each facility and every resident's vaccination status according to AIR. And from there, I worked on the site to build a tailored catch-up schedule to be delivered over the following 6 months, so month 0, 3, and 6. I used a fully digitalised system, so facilities could send out links to their next of kin, capturing consent and pre-screening, while also sharing clear evidence-based information about each vaccine and the diseases they prevent. Once on site, that data was instantly available to me, and at the click of a button, the system connected live to AIR so I could verify that no other provider had recently attended, I could then administer the vaccination, click just where the site where I did it, so left, right arm, and then click complete, and hey presto, because in the morning with this software, I could allocate the batch number before I got there. I'm not typing the batch number every time. I'm pressing complete and it already knows what batch number I'm doing. So it automatically went to air, so for immediate reporting. And I'm not sure how your claiming works, but for us, it's through a system called PPA, and that payment happened automatically as well. So I could have stood here today and I could have shown you one of my best facilities, which happens at 12 months, but I actually wanted to show you my facility at 6 months. So this is the facility I went to last week, the 15th of October, maybe that's 2 weeks ago now. But I wanted to show you what it looks like at the halfway mark and why it matters, the next step that I'm going to talk to you about. So when we arrived in April, influenza coverage was 0%, and in fairness, it was the start of April. COVID-19 was 39.7%, pneumococcal was 14%, and shingles coverage was 13%. And of course, you can't see that. But essentially the yellow is what was due now, and then the green line that indicated that they were up to date. So after 6 months, I just want you to keep your eyes on it. This is what we were able to achieve. And just for visual effect, let's do that again. Okay, so influenza rates were 92%, COVID was 74%, pneumococcal was 74%, and shingles was 74%. So forget the odds ratio of 1.68. My lived experience is that odds ratio is that 8 times more likely if I took the vaccines to them, but I did it in a coordinated manner. So the other thing I will say is that the way I work with my facilities is they're now already booked in for the next 6 to 12 months. So all of their flu clinics are booked in next April. Be good if I had the vaccine in time. And their COVID vaccines for the next 12 months. So that to me is not a no-brainer. But here's why I wanted to show you the 6-month mark, because for me, 74% is not good enough. See all of those reds and greys on the chart? So the reds are the ones that downright refused to the clinic, to the facility directly. The greys are the ones that we didn't get the consents back from. So they're ones that I need to follow up. The next phase for this facility is outreach, one-on-one conversations with those residents or next of kin to explore what vaccination looks like as part of their loved one's care plan. Because my experience tells me, and if I brought you up a 12-month one, we can get those rates to 95% with those continual conversations. Yeah, so when I attend in 6 months, I think, what's it say there? I went on, yeah, I've got a catch-up clinic on the 10th of December. Look, I'm telling myself what my schedule is. I would expect that I would have had those phone calls in the next 4 to 6 weeks. And that by the time we do that catch-up one, or by the time we get to the flu clinic in April, that we'll be sitting at 95%. And the other thing is I've already established a relationship with those families. They've got my direct email. If they've got any vaccination questions, they're emailing me directly. Okay, so I want to move into the next point, which is communication, or the second priority. Engage with communities to build trust and understanding in the value of immunisation and to combat misinformation. And it's never been more urgent. The ACMA 2024 report found 4 in 5 Australians had seen COVID misinformation. That low risk is consistently cited as a reason not to get vaccinated. There is confusion and mixed messages. And finally, online misinformation is now starting to shape behaviour. Videos circulating on TikTok, Facebook, YouTube, and Instagram. This is happening. And older Australians over 55, sorry, excuse me, I should have done that slide before when we moved on to it. Australians over the age of 55 are less confident than younger users in identifying misinformation when they encounter it. And if you think it doesn't affect the older generations, then you haven't met my parents. My father is a warrior when it comes to Facebook comments, even though he doesn't know anything about the topic he's commenting on. And my mother buys more things on Marketplace that I'm pretty sure that my dad is going to get abducted one day when he's picking things up on the side of the road. So the volume, and this is the alarming thing, that even though the volume of harmful misinformation remains, the volume of harmful misinformation remains persistent, even as the number of individual pieces of content actioned by platforms has declined. So here is a video that came across my dad's feed. I'm not quite sure what it says about his algorithms, but he decided he likes to help me in my new role, so he sends me things.
To detoxify from, but there's researchers coming up with a few things, and one is zinc, and the person can take a zinc supplement, or they can ensure that they're having pumpkin and sesame seeds and sunflower seeds every meal because they are high in zinc. Also dandelions, so it can be simple of having a dandelion tea or coffee every day, taking dandelion supplements.
Dandelion. And then as the more I started working in aged care, I realized there's another layer next of kin. And these are the people who are getting their information from TikTok.
Vaccinating our children. I have a serious question. Okay. And this is not meant to start a debate in the comments. We're not attacking each other in the comments. If you vaccinate your children, that's great. If you don't vaccinate your children, that's great. It's all your personal beliefs. But I don't fully vaccinate my kids. I only partially vaccinate my kids. Okay. But I've been doing a lot of research into vaccinations and everything that's in them, and especially everything they're giving newborn babies and all the things that they're pumping into our kids. So if you do not vaccinate your kids at all, okay, and again, we're not attacking each other in the comments. We're being adults, okay? If you do not vaccinate your children, I want to know why. And I want to know if you think there are health benefits. Like, are your kids healthier than most? Do they get sick less than most? Do they seem to have a better immune system than most kids? Like, I want to hear your experience. Because I'm a mom of 4. My first child is fully vaccinated. And as I've had more, I've vaccinated them less and less. So I want to know, if you don't vaccinate your kids, tell me your experience.
If you don't vaccinate your kids, tell me your experience. It's an echo chamber, and it will feed and feed the misinformation. And it's the generation that's coming through, and they're in the meetings, they're helping their parents make decisions, and they're turning to TikTok for answers. And until a few months ago, I was watching your faces as she was speaking. I was the same as you guys, giggling, kind of like shrugging it off, scrolling past, really. That's what we do, right? We just scroll past. And then I realized there is an online space where misinformation is becoming the default. And this is the world my children are growing up in. And the alarming thing is that they're actually the ones that are going to be deciding they're going to be signing my next of kin. So it's not really about them. It's about when I end up in the nursing home. But it's, you know, all jokes aside, it's actually quite serious. So I really thought about it, and I thought, if I want to put priority 2 as one of my, you know, this is our national strategy, I have to engage with communities to build trust and understanding in the value of immunisation and to combat misinformation. That's what the strategy says. And that includes online communities. So I joined the conversation, not to go viral, but to reclaim our voice in a space that we've been quiet for too long. Here's one of my videos. It reached 30,000 views. That's 30,000 counter narratives. And I wouldn't have had those conversations if I just stayed silent.
Had a family friend who had a baby at the same time, was a few months in, gave vaccines to the baby, and the baby had seizures and has had seizures since.
Let me help you process what's going on. Most seizures we see after a vaccination aren't caused by the brain being harmed from the vaccine itself. Rather, they are caused by something called febrile seizures. They happen when a child's temperature rises quickly, and that most often is during an infection. A vaccine can sometimes trigger a fever, and very rarely that fever can bring on a seizure. According to the Australian Immunisation Handbook, there is a small short-term increase in febrile seizures after the first dose of MMRV, and it's about 0.7%, and it's usually at about about days 7 to 12. And that's why we give the MMR first at 12 months and the MMRV at 18 months. Other shots like flu and pneumococcal given together in babies can also raise the risk, but it's still rare and brief. In fact, studies show children who have a febrile seizure around the time of vaccination recover fully, and it's safe to continue with future vaccines. Please remember that diseases like measles, meningitis, flu, and whooping cough are far more likely to cause seizures or long-term harm than vaccines ever are. The protection is worth it. So if you've seen something scary or heard a worrying story, please don't sit on that fear. Talk to your pharmacist. We'll go through the evidence together so you can feel confident in your choices.
I was like, no, I'm not getting any vaccine.
Not again. Look, I get that this is not everyone's cup of tea, and that's okay. But it is time to show up, not defensively, but confidently. Not to argue, but to connect. And we can't outspend the information, but we can outtrust it. We still remain the number one source or most trusted between GPs, nurses, what am I, pharmacists? Like, that was one missing. We are still the most trusted. We just have to engage and be part of the conversation. I assume most of you have some form of online presence, and I'm not saying that you need to start recording yourself, but you can find credible voices you align with. You can find me. They made me choose a new name because the content creator said that my current socials were so sad that she couldn't work with those. So she made me choose the vaccine pharmacist. But what I'm saying is I wasn't a huge social media. I just scrolled past because I thought this is absolutely ridiculous. But in the last couple of months, the traction has been enormous, and the conversations that I have had have been significant. And we can rebalance the narrative, one post, one comment, one conversation at a time. Okay, let's land the plane with the fourth barrier that I spoke about at the start. I'm looking at Rod because am I still all right to keep going? I've got to wrap it up. Okay, so complex schedules. Essentially, the findings were multiple vaccines, frequent updates and formulation changes, and confusion for both patients and providers remain, I guess, the things identified causing the complexity in the schedule. So I just wanted to point out, and I'll go really quickly, but this is my favorite tool to use. So when someone comes into the pharmacy, there's this vaccination for healthy aging. It's more than a schedule, it is a roadmap to confidence. And it's the foundation of my consultation, and I just added, I've added a few things to it. Sorry, Department of Health. But it doesn't have COVID on it, and it was developed before RSV was available. So I've added that to it. So my role is to transform it from a reference document into a conversation tool, one that focuses not just on disease prevention, but what it means to age well through the lens of function, independence, and quality of life. Because when we shift the discussion from what's next on your immunization list to what's next in your life, the dialogue changes completely. Each vaccine becomes more than a line item. It becomes a checkpoint on the patient's journey to staying active, capable, and connected. And if you can nail that, this is what this is what my scribble looks like. So I won't go through these, but online you'll be able to see it and I guess take a picture of it. But when I'm getting to these, I'm having conversations. It's not saying you're due for it. It's actually talking about what it's going to do for their independence, how it's going to help them interact with their grandchildren. So, RSV, it's a newer one, a respiratory illness that can hit really hard, particularly when you have underlying conditions. I think she was a 68-year-old lady, and I think it was the Spiriva that set me off to talk to her about RSV. But what I'm saying is she was up to date with the green ticks. The orange arrows, I vaccinated her there and then on the spot. And then I booked in, she wasn't 70, so I actually booked her in for 2 years' time. And that seems crazy, but she's going to get a reminder in 2 years' time because I'm not going to ring her in 2 years' time. But my booking system will still be there. So that's going to remind her in 2 years' time. And I've already booked in her shingles vaccination for, I think she wanted a 3-month coming to Christmas. But anyway, all that to say is it's not hard. You've just got to do it. You've got to do it confidently. And this lady walks away. She's aging. Wow, she's aging healthily, and that is got to be our goal. And the final thing, Rod's getting up here, but value is personal. So don't assume someone's not going to pay for the non-funded ones. Patient planning to go to Europe, they may decide not to pay for it. Someone on a concession card might decide that their independence is worth paying the $300. So thank you. And
No, thank you. So certainly triggered some responses, but not from social media. But again,
I wanted more views.
well, it's unfortunately it's turf war continues. Pharmacists want to be doctors, etc. So maybe there's a challenge, and maybe this workshop is a great opportunity for us to work through that offline and maybe not directly. But the challenge has been, how do we actually get a united front rather than pharmacists telling people they can't see their doctor because it's too hard, and the doctors don't believe the pharmacists are trained. So first question, deal with that before we then tackle the social media.
Yeah, I come at it from, if you guys rang me up as a GP, I'd come and fix your situation too. Like for me, it's not going, oh, I'm a pharmacist, I can, or GP. We've got a problem, and we have a national immunisation a plan, and we want to implement it. And I hope that what I'm doing encourages you. I've presented a few webinars recently, but one of them, I looked at the safety numbers from when, it was a really great question. And I so validate your concerns with the idea of pharmacists giving, 6-month-old, injections, and that kind of, that resonates. We need to, if someone has anaphylaxis, it needs to be looked at seriously. But the OzVax safety data and NSERS had a look at it, and the reports are saying that there has been no increase in major adverse effects from the expansion of the immunisation program. So for me, I get it, but I'm not seeing that translate.
Yeah, thank you. And the other comment that I didn't reach was that vaccine numbers have gone down since pharmacists have been there. So that's, again, we've got to approach that and deal with that. So I think
is that my question would be, would they be worse? Is it the fact that we've kept them steady? I'm just asking the question, right?
I'm just reflecting what's been sent to me. So I've got a question in the.
Hello, I'm a
Hello.
nurse. My name's Elisa. I am just wanting to say that I love your presentation. I'm following you now on Instagram.
That was my real aim,
what
actually. Don't even give me an honorarium for being here.
What
just
you
that.
said, it's just what we need. The promotion, the encouragement, like people are unsure, and I'm a nurse and I'm sometimes unsure, and because there are vaccine injuries. But I think the promotion, what you were doing on Instagram, is just right.
Oh, thank you. And it is a huge thing. And I do encourage people, you can't speak to things. When someone comes in and says vaccine injury and you think that that's just vaccinating too high, that's not what they're talking about with vaccine injuries online. There are so many, you need to watch it, and you need to know what you're actually countering. Vaccine, even with HPV, the amount of POTS stuff that's coming through, like you need to be across it, because when these people are coming in, they expect you to give them an answer. And if you're mumbling and fumbling your way through, I'd probably go with the polished TikTok video. So that's my feedback there. Thank you, though.
And I remember when online you get a chance to answer some feedback, and we'll be looking at it. And here in the room we've got.
I just had an addition to that.
Yeah.
Because I just had a quick Google on Instagram to check. Nurse immuniser, nurse vaccinator. There's a real problem for health professionals like nurses and doctors. We really have to be mindful of what we put on any social media. So that does limit what we, I understand how we would all love to go out there and say, immunise your children, but we can't actually do that. So that is a challenge. And if you work you're in a community and you own your own business, that's different to what we do within the confines of the work that we do.
Yeah, thanks for raising that. And that's why I guess it's knowing what you can do. And so if you're just resharing my stuff, I don't think that's a problem, so trying to reach where we can. Look, I'm not saying I have the answers. I'm just trying to, we would be naive to think that that's not going to have, it's not happening. So, yeah, that's a great thing you raised.